We are today here because the seventh report from the Lancet Countdown is being released, and you know that health is becoming an issue which is extremely important, and not talking about only health in traditional terms, but also health of the planet. You know, a more holistic approach to health, One Health, and climate change is one of the biggest threats. And this report is becoming an essential and fundamental global assessment that regularly introduce us on the topic. So I would like to introduce Anil. Well, many of you know him. Anil Markandya is a merit professor in the PC3, and he was the former director. And he's also been engaged in the committee, which is, you know, launching these reports, these Lancet Countdowns, for a while, and is author also of many of them. An author of this one concretely, which is been having a very strong repercussion in the media. And I guess the point is that the impacts are there, the health impacts are there. It's not only heat waves, and he will illustrate that to us, but there is also opportunities which are need to be taken into account if we think in terms of how to address this climate change challenge. So Anil, before I give the word to you, I would like to say that the questions after the seminar can be put in the chat box, and I will bring them to Anil as soon as they appear in the chat box. This will be more efficient because we don't have that much time. So thank you very much, and Anil, the floor is yours.
Thank you, Maria Jose, and let me take this opportunity to thank the colleagues with whom I've worked on this report, the 2022 Europe report on health and climate change, the Europe report towards a climate resilient future. We've had some presentations of this, and it's my pleasure to present this here to you today. The Lancet Countdown on Health and Climate Change is one of a sequence of reports which started a few years back, and it has been done in conjunction with University College Institute for the Global Health Commission, recognizing that climate change is the biggest global health threat of the 21st century. And this is a major statement to make because there are many threats to health, but the Lancet has taken the view that climate change is probably the biggest of them all. This report therefore fits into that sequence, and it goes into some detail about the impacts in Europe, and I'll go through them in sequence. The report is also one of a sequence of reports which cover different regions of the world, including Australia. There's a report coming out in South America, one in Asia, Africa, and small island developing states. And this ours is one which focuses on Europe. So these taken together offer a kind of overall view of how health and climate change are related in different parts of the world. There is also a global report which came out, which was also got a lot of publicity, which synthesizes the views of these individual reports. So the approach we took in the Europe report was broken down into 5 components. We looked at climate change impacts, their exposures and vulnerabilities. We discussed adaptation, planning, and resilience for health. As Maria Jose noted, there are also actions and opportunities that we need to take advantage of. There are mitigation actions which are being taken, and there are significant health co-benefits associated with them, and we discuss those. Then there's a section on economics and finance, which is the one which I led in the report, because of course the economics of actions and the impacts in economic terms are very important. And then the last is the issues relating to politics and governance. So I'll go through each of these as I go through the report. Just briefly, the first report was published on the scope of the collaboration was in September 2021, and the first indicator report, it now includes 33 indicators. And there are 44 researchers from 29 institutions, and the 2022 report just came out. This is just a cover page. You have access to it. It is open access, so you can all get to see it. The different areas in terms of impacts that we looked at heat and health, and under that there are a number of separate issues: vulnerability to heat exposure, exposure of vulnerable populations to heat waves, physical activity related to heat stress, and heat-related mortality. Then there's quite a lot of discussion on extreme events in health, which include wildfire, smoke, drought, and climate-sensitive infectious diseases, particularly West Nile virus, dengue, and malaria, and then some things on allergens and allergenic trees, although I might not say much about the very last. And these are the different ones. You can see here the heat vulnerability index exposure, and the headline finding is that vulnerability to heat exposure has risen steadily across all European regions, with an increase of 4% from 1990 to 2019. And this may not sound much, but it has a significant impact. Older people in Northern Europe are more vulnerable to heat exposure than in other parts, and the highest increase over time has been observed in Central and Southern Europe. In terms of exposure, European populations are being exposed to increasingly frequent, intense and extensive heat waves. And between the first and second decades of the 21st century, heat wave exposures increased 57% on average, with local increases of more than 250%. And if you look at the map here, you can see how different parts of Europe are affected, and particularly significant impacts in Central Europe, but also in Spain, particularly on the eastern side. The impacts have been very much at the top end of what we can see across Europe. And if you look at the same on the very last map, the change by decade, the decadal change in heat wave exposure for over 65s also tends to find very significant impacts in both Central Europe, but also Spain tends to be, and on the eastern, southeastern part, very much impacted. Physical activity is also affected by heat stress, and here the headline finding is that heat stress during physical activity has increased across Europe since 1990, particularly in Southern Europe, where risky hours per person reached 429 for medium intense activities and 627 hours for strenuous activities. And you can see on the map here that the steady increase, there are the trends are there, the variations from year to year, but these effects are now becoming quite apparent. And then we have heat-related mortality, which is of course been a matter of great concern, and especially with these very hot summers that we've had recently. And these are assumed to have increased in 94% of the 999 regions that we monitored from 2000 to 2020, with an overall average increase of 15.1 annual deaths per million inhabitants. And again, you can see it. This is somewhat alarming, but of course you can see if you look at the intensity of the effects, how significantly Spain is affected. not so much in the region where we are based, in the very north corner in the Basque Country, but almost everywhere else in the central core of Spain, the effects are among the highest in Europe. The next one section we look at is more to do with extreme events. And here we move to wildfire smoke. And here the exposure to wildfire smoke has had a small but uncertain negative trend. It's not so clear what has been happening in terms of exposure, in terms of measured in terms of PM 2.5 concentrations. And there's been some declines in some places, but the regional fire danger indices have shown positive, but they're not statistically significant trends in Western Europe. So we have a more mixed picture in terms of the trends over time for this, but it's an area which also is one which is getting considerable concern in different parts of our continent. And then we come to drought, and where we looked at the figure. This again is something which affects health indirectly, but of course it does have an impact. And we find that 55%, that's 184 of the 334 NUTS 2 regions, have faced extreme to exceptional summer drought events between 2011 and 2020, in which 1/3 have experienced more than 40% of the drought events recorded over 7 decades. So it's a really a picture of increasing drought events. And you can see again the picture here, it's more evenly spread over Europe. It's not particularly concentrated in the Iberian Peninsula, but even here, the percentage of extreme drought events in recent years has been is quite sharply significant to us. And then we look at other diseases, and particularly pathogenic Vibrio is increasing across Europe over recent years, both in terms of seasonal length and percentage of coastline with favorable conditions. Particularly, you can see the areas it's more in the Baltic Sea. Seashores are particularly suitable, with a steady growth in the number of days and kilometers of coast which have been suitable for this non-cholerae Vibrio, which is again is a trend we don't have so much in terms of actual health impacts of this, but trends in terms of the conditions for pathogenic diseases to grow, and there are little pockets in the south as well, marked in blue. The West Nile virus, again, an accelerating trend for the West Nile virus outbreak was observed between 1951 and 2020, with the highest increases in Southern Europe, about 149%, and Eastern Europe, 163% over this period. And the graph shows you the picture, the way in which it has been increasing over time. Dengue is again, and the basic reproduction rate and the length of the transmission season has increased in all European regions from 1951 to 85 to 86 to 2020, with an overall increase in the reproduction rate of 17%. Malaria, again, something which used to be present at the beginning of the last century in parts of Europe, is making something of a return. The highest change occurred in Northern and Western Europe, with 21%, 22% and 25% increases in suitability from 1951 to 85 to 1986 to 2020. We still don't get many cases, but the trend is towards increased conditions for the development of malaria virus, the malaria transmission. Now let me turn to adaptation, planning and resilience for health. And in this section of the report, we talk about planning and assessment. How well are we geared up for dealing with these national adaptation plans, city level climate change risk assessments, and the delivery and implementation of adaptation in various forms, including information, green space, and air conditioning benefits and harms. What are the headline findings here? Well, in 2021, and 10% of the 22 countries reported having undertaken a climate change and health vulnerability assessment. So still several have not. And 14 of the 22 countries reported having a multi-stakeholder mechanism on health and climate change that is currently operational. So we are still some way from having us being well prepared for dealing or developing appropriate adaptation actions across Europe. In terms of adaptation planning, 15 of the 22 assessed European regions have national health and climate change strategies or plans in space, but the implementation of these is still some way from being completed. And 8 of the 22 of these countries reported having moderate or low levels of implementation, with only 3 countries reporting very high implementation. Again, we see our degree of adaptation is lacking. And we look at city level climate change risk assessments. These are very important because a lot of the action is taken at the city level. And we find that since 75% of Europe population in Europe lives in urban centers, climate change assessments are critical. Of the 197 European cities in 2021, 150 had conducted some kind of climate assessment. And 118 of those cities reported that climate change threatened health services or public health. Now, with heat-related illnesses most prominently identified as a climate-related health hazard. So this is something which is very active and need and is areas where action is being taken, and we'll need to discuss the financial and economic implications of this. And then climate information for health. Now, this is an area where things are more positive. In 2021, 10 of the 22 countries reported having climate-informed health surveillance systems for heat-related illnesses. Well, I say positive, it's still 12 countries don't have that. 38 of the 22 countries have systems for injury and mortality related to extreme climatic events. 6 of the 22 have the systems for vector-borne diseases, and 4 only of the 22 for waterborne diseases. So perhaps I was being too optimistic when I said the climate information systems are moving. They are moving, but there's a lot more to do. And then we have the issue of green space, which is one where also many of my colleagues at BC3 are working on this. And we have what we call populated weighted greenness has actually increased somewhat from 2000 to 2020 in most European countries, with the largest increases observed in Southern Europe, about a 13% mean increase, and the smallest in Western Europe. And the mean urban tree coverage in European cities was 28.5%. In 2018, and 35.8% of the city, including commuting zones. And the map can show you here, and we see here again, actually Spain does rather well in terms of the increase in greenness compared with Northern Europe and certainly the central areas, although there are other parts, particularly in Southeastern Europe, which are the way in which things have improved here, but look at how significantly green are the increases in how significant increases in greenness in all across the Iberian Peninsula, at least in the Spanish part. And then let me turn to air conditioning. Now, this is a mixed picture because, of course, it both has benefits and harms. And for most European countries, the proportion of households using air conditioning has increased steadily. So you can see in the map here, some increases in pretty much all across Europe. Italy's was been particularly high, but has been showing a mixed picture. And of the countries with individual country data, the highest increases were actually in the Northern Europe, in Finland and Germany. Now, the downside of air conditioning is, of course, that it contributes significantly to greenhouse gas emissions and also to air pollution and peak electricity demand. It also creates urban heat islands because the air conditioning inside increases the temperatures, ambient temperatures in the city. So if there are ways to address the problem of cooling in ways that don't depend so much on air conditioning, that would be a development which should be desirable. And then we have operationalized early warning systems for climate adaptation in Europe. And here we've had, again, quite a lot of success. We have a significant European flood awareness system, European Drought Observatory, the European Forest Fire Information System, and the European Centre for Disease Prevention and Control, the Vibrio Map Reviewer. These are all developments which have been moving forward, and they are important in helping us to develop adaptation actions in the coming years. Now let me turn to the mitigation and action, the co-benefits issue. And this picture here shows you that we have target sectors for mitigation policies: energy, transportation, food, systems, and land use change and forestry. And these in turn are linked to exposure pathways of air pollution, noise, temperature, road traffic, diet, physical activity, and nature exposure. And in turn, these then have health impacts, both in terms of non-communicable diseases from air pollution in particular, but also mental health, infectious diseases, and unintentional injuries from things like road traffic. And the indicators we have developed in this section relate to the carbon intensity of the energy system, coal phase out, renewable and zero emissions, zero carbon emissions electricity, premature mortality, which is attributable to fine particles, sustainable transport, life cycle emissions from food demand, and sustainable diets. So I'll go through some of these and give some of the results we have. The headline finding on carbon intensity is that the news is not very good. Between 2005 and 2019, emissions from fuel in Europe fell by 14%. But the COVID pandemic had the impact of temporarily reducing emissions by 8%, but that has been lost. The path we are on is this one. Path we need to be on is this one for carbon intensity of energy. So we clearly need to move from going this on a path which looks like this to one which is much more aggressive in the reduction of carbon intensity. And these are the emissions from fossil fuels in different countries over time. I'm sorry, I can't quite get the bottom, but yeah, these are for different years, and you can see contributions of individual countries. The coal phase out, which has been moving since 1991, coal use has dropped in Europe by about 56%, which is significant, but it still remains a substantial fuel in the Europe energy mix at 12% of total energy supply in 2020. And current rates of reduction are incompatible with reaching the net zero by 2050 target. So you can see here that we're not on track for achieving that phase out. Renewable and zero carbon electricity, well, we are moving in that direction. The share of zero carbon energy supply in Europe is still only 21%. And the share of renewables and electricity across Europe is 17% in 2020, despite rapid growth in electricity generation from wind in Denmark, Ireland, in the UK, and solar in Germany, Greece, and Italy. Also in Spain, we've had increases in the share of wind and solar, but overall in Europe, we still need to make a big increase in the use of renewable zero carbon emissions and energy, and particularly electricity. The story with premature mortality attributable to ambient particles, well, we know, we've known for a long time, that particulate matter is a leading environmental risk factor for premature mortality. And here, over years, the air pollution-related deaths from combustion of fossil fuels have decreased sharply. They've decreased by 60% between 2005 and 2020. But that still leaves us about 120,000 deaths annually that are attributable to these sources. And you can see the changes in different parts of the of Europe. Say looking at Southern Europe, from transport, it's been declining. From coal, it's been pretty steady, and there's been some decline in coal from power plants, but we still have quite significant deaths per 100,000 of population. So there's still room for getting some co-benefits from reductions in the use of these fuels. Then we come to sustainable and healthy transport. Here, the picture is still quite difficult. Shifting towards public or active forms of transport can not only help reduce emissions, but can also contribute to reduced noise pollution and increased physical activity, which helps to improve overall health. Per capita fossil fuel use in road transport peaked at around 23 gigajoules per person in 2007. It has declined, but it's still quite small. Electric vehicles are growing, but remain a small fraction of energy use for road transport. You can see we're kind of peaked around here. We're coming down a bit, but we're still quite high in the use of fossil fuels for transport. And then we come to food, which is very much an important part of every country's culture. But between 2010 and 2019, there was very little progress in reducing emissions associated with European food demand. In 2019, it amounted to about 1.85 gigatons of CO2 equivalent. And animal source foods continue to be responsible for over 2/3 of these emissions. And so you can see different parts of Europe. These are the emissions due to food demand and total emissions. So if you look at Southern Europe, the significant half of the emissions are coming from something like food demand, and the share within foods in 2019 isn't that different from what it was in 2010 for the different types of foods. So meat, particularly dairy and eggs, are the major sources of emissions. And then we turn to sustainable diets. Well, dietary shifts towards plant-forward food consumption is going to be an important part of our action needed to achieve decarbonization in the agricultural sector. And here it is quite surprising how big the figure is, but about 2.2 million deaths in Europe were attributed to what we would call imbalanced diets in 2019, representing more than a quarter of all deaths among adults. So it really does make a difference what you eat in terms of your likelihood of premature death. Between 2010 and 2019, the proportion of diet-related deaths decreased only 2%. Again, the effect we are having in terms of diet is still very small. Let me now turn to issues of climate, the economics and finance side. And here we are looking at some of the losses associated with climate-related events and how and some of the costs associated with these impacts, health impacts that we've talked about. We also talk a bit about the economics of the transition to zero carbon economies, and maybe the fact that we are still giving quite significant fossil fuel subsidies. So firstly, the economic losses were one of the biggest sources of economic losses due to climate-related extreme events is the picture here, and you can see these were the losses over years. They vary a lot because the extreme events are unpredictable. But look at what happened in 2020 and 21, and the highest losses were in 2021 with 47 billion euros of loss. Majority of these losses were experienced in Germany, which it had huge losses due to extreme events, over 30 billion in the last year. So this is a cost which part of which, of course, is related to health, but of course it also includes lots of property and damage, property damage as well. They will also have something called a change in labor supply. And here what we find is that exposure to extreme heat undermines people's capacity to work, both through the direct impacts on the health of workers and reducing labor supply and productivity. And labor supply in high exposure sectors was about 1%. So not many people work in very high exposure sectors, but it was about 1% lower in 2016, 2019 than 1965 to 1994. So we had some decline in labor supply due to higher temperatures. In comparison, in 1995 to 2000, the reduction in labor supply was only 2.23%. So we're seeing an increase in the labor supply that is being affected by higher temperatures. And again, the effects vary across different parts of Europe. Here, the pictures vary over the continent. There's also the impact of heat on economic activity, and here it's a bit more complicated. But in 2019, relative to 1981 to 2000 temperatures, GDP per capita growth in Southern Europe was 0.9% lower due to temperature anomalies and 0.16% lower in 2001. So we can see again that in recent years, the temperature anomalies are affecting our economic growth. And this has a big effect on living standards over time because growth accumulates and the effects are being seen here. But also note that there are significant uncertainties about these estimates based on economic modeling, but you can see certainly the impacts in some years were the ranges of the estimated impact were quite large. And then we have the monetized value of unhealthy diets. And these figures were some work done by colleagues in health institutes in the UK. So found that the value of imbalanced diets, because of the loss of life that I mentioned earlier, amounted to nearly $9 trillion dollars in 2019. And the value of imbalanced diets was highest in Eastern Europe, where it amounted to about 56% of that region's GDP. But we have to be careful here that we don't interpret this to mean that if we remove imbalanced diets, GDP will go up by 32%. This is just a way of measuring the loss of the value of the loss of measuring the value of the loss of life, which is very significant because of imbalanced diets. Let me turn to now the net value of fossil fuel subsidies and carbon prices. And here we find that still 28 of the 53 countries in Europe reviewed had a net negative carbon price. In other words, carbon was not being priced positively. There was still a subsidy for fossil fuels in a number of sectors. And 15 countries provided net subsidies to fossil fuels exceeding 1 billion euros a year. So the median value of subsidies in countries with a net negative carbon price was around 1.2 billion. So instead of actually pricing carbon positively to discourage its use, there are areas where it is still priced negatively, and that is not helping the transition. Let me turn now to the last section, which is on politics and governance. And here the indicators are on the coverage of health and climate change in our own work, in the work that we and our other institutes are doing. Individual engagement with climate and change on social media, political engagement with health and climate change, and corporate sector engagement with health and climate change. And one thing which we do find is that there's a significant growth in scientific papers investigating the intersection between health and climate change. You can see here, particularly the papers are mainly on impact, some growth in papers on adaptation, and some growth in mitigation. But mainly people have been working to understand more the impacts. And these are the places where the publications are. You can see we are having quite a lot of increase in the work in our part of Europe, significant in terms of the location of studies on the nexus between health and climate change. Understandably, because the effects are so important here, particularly Spain, Italy, and then Central Europe and Germany. 366 relevant papers were published mentioning locations in Europe, increase of 9% compared to 2020. And while research on health implications continues to dominate the health impact, there is increasing attention towards solutions over the last 10 years. We have individual engagement also with health and climate change on social media. And here we find the percentage of tweets mentioning the word health in total number of climate change. And you can see it varies quite a lot, but there's a significant increase in some countries. And there was a spike in engagement towards the end of 2021, linked to the COP26 summit and the publication of the Lancet Countdown annual report. And then we have a political engagement with health and climate change, and engagement with health and climate change by legislators in European Parliament still remains relatively low in 2021. The highest engagement with climate change came from the Progressive Alliance of Socialists and Democrats and from the German legislators. Yeah. Okay. Sorry. And then we have the engagement with the corporate sector and engagement with health and climate change among European countries. That have signed up to the UN Global Compact has increased to their highest level in 2021, with 35% of corporations referencing health and climate change in their reports. So we're seeing some significant growth in there, and this is a list of the different companies. The copy of the presentation will be available should you want to have a look at it. And then we have the impact of the Lancet Countdown in Europe, which highlights the accelerating trends in health hazards, exposure, vulnerability, and risks from climate change, and a lack of sufficiently ambitious adaptation mitigation strategies. And here you can see the impact indicators and then the number for the different kinds of health impacts, and there are significant increases, but the response indicator space is much less. And you can see less has been done to try and provide information on these response indicators, while there's quite a lot on the impact indicators. So this is overall the idea of the report, the idea that we find accelerating trends in health-related hazards. There's a lack of sufficiently ambitious adaptation mitigation strategies, and the implementation of ambitious strategies will not only protect lives and human well-being in Europe, but also in populations that have historically contributed least to anthropogenic climate change. Let me turn, this is just a list of the authors' pictures list that is not particularly interesting for you, but these are the people who worked on the report. And these are the institutions that were involved, including ourselves, BC3, but we are part of a big network, including the WHO, major institutes in the ISG in Barcelona, and the University Pompeu Fabra also in Barcelona, but many others. And many of these institutes are also ones with whom we have been collaborating ourselves at BC3. Let me turn now to a few words towards just to finish on the ongoing research and the open questions which we are planning to work on. And there are several programs which are already ongoing which seek a harmonization of approaches to understanding the approaches to studying climate change and health, and an increase in the attention given to the impact, strengthening science for policy links, promoting synergies, trying to avoid overlaps, streamlining information flows, and improving communication and dissemination. These are some of the current projects which are ongoing in the system. They deal with data management, policy strategy, scientific synergies, and communication dissemination. Let me mention particularly Blue Adapt, which is one that BC3 is leading, and I think on with Mark and Aline and others are working on that. I'm a little bit engaged with the people in Catalyze, which is also looking for decision support systems. And there are IDA, Trigger, and High Horizon. These are ongoing projects which are part of the health impacts of cost, benefits, or action and inaction under the Horizon programs. So the questions I feel that still need to be answered, and which we plan to work, is one: firstly, how to optimize health in climate change mitigation and adaptation. Second, how to close knowledge to action gaps to accelerate climate change actions. Third, we know some interventions are very cost effective, like early warning systems, but the cost effectiveness of the others is still not well established, and we need to work on that. Fifth, budgets of departments of health will need to be increased to deal with climate-related health impacts. But we do not have good estimates of how much, and this is something we need to do some work on the economics and finance. However, addressing health in mitigation and adaptation is not only for ministries of health. As you can see, it involves actions in ministries of social security, agriculture, transport, and energy. So mainstreaming health policy in these ministries is something which remains a challenge. Let me stop and thank you for your attention. I've left a little bit of time. Happy to answer any questions.
Thank you, Anil. I think there is there is one question.
Yes.
Yes, thank you for your presentation. Is there any or plan follow-up work in relation to equity and justice implications of these trends?
Yes, absolutely. There is a work we ourselves are involved in a program which we are going to look at, and where we're looking at the health equity impacts of particularly in relation to exposure to heat and exposure to extreme events across different social groups. There's one project which we have just started working on, which is called Adjust BC3. We are part of the network, which is talking about this what we call a just transition, where we will be concerned partly with health impacts, but others. And there's one which we just submitted now, where we are planning to look at the health effects using data, cross-section data, household expenditure, household data, to try and understand which exactly how different groups are affected in terms of health, and ones that are likely to need the greatest, if you like, support as these health impacts occur. Yeah, it is a very important part of the ongoing work, which and should have given it greater mention. You're right.
Thank you. I don't see more questions in the chat, but I would like to ask you a question, Anil,
Yes,
because
please.
there is now this is emerging, well, not so emerging now, but the enhanced idea of planetary health. And my
Yeah.
question to you is, how we link the planetary health with the health as is been understood, which was evolving into One Health. So how we put these two things together, and as you said, this is not a question only for ministers of environment or ministers of health.
Yes.
It's a question for more integrated approach across the governments.
Yeah, you're raising clearly an important point, because health is one component of the overall picture, and of course we cannot concentrate only on the direct health impacts to be able to undertake the appropriate actions to mitigate climate change, or to adapt to the health effects. As I said, we need to bring in other ministries, other other sections. And this is something which is still difficult to do. We are finding it, yeah, the planetary health is a wider concept, and human health is a key component of that. But to bring in the actions that need to be taken in a kind of integrated way, we still haven't kind of quite figured out how to do that. So this is part of what we need to work on.
Sure. Well, let's see if someone also send more questions. But another point that I wanted to ask you, Anil, is you know that you show this picture of Spain, where the impacts of heat waves are more in the north, in the south than in the
Yes.
north, right? But the adapted capacity may be lower in the north. So is this
Yes.
being taken into account?
No, not fully, because what that shows is just well, to some extent, yes, because that shows the actual number of cases which were estimated to have occurred as a result of heat waves. So, I suppose to some extent, it does take account of the fact that the capacity is where the capacity is greater, the effects should be less. But whether that's fully accounted for, because if you are affected in the north, and you're, again, this question of equity comes in, that if you are living in a home or dwelling which is poorly adapted to being able to be kept cool, and you don't have air conditioning, and many of the buildings in the north may be less well equipped, then the effects for people of extreme heat will be just as bad, will be worse there than they could be in places where temperatures are more frequently higher. In fact, we have experience of this from in the other direction, because of the evidence from particularly in winter, when they've had bigger losses in southern Europe from temperature variations than they've had in northern Europe.
Yeah, we have another question that says that at the local level, there is a lack of integration of both policies, adaptation and mitigation. In general, because they are managed in different areas of the administration without any coordination. How do you think this practice could be changed?
But to mean to integrate mitigation and adaptation policies? Well, yes. I mean, this again would come down to having to understand the like, when we talked about air conditioning and as perhaps a possible source, where we look at policies for adaptation, but we then don't take into account the mitigation consequences of introducing those policies. So we would need to have some form of integrated assessment systems, where we look at both the benefits and the costs across both the adaptation benefits, but also any mitigation costs, and vice versa. And we may, in cases where we have mitigation policies, for example, in Europe, in Northern Europe, at one point, we went for mitigation policies from vehicles of using in promoting the use of diesel, because it has more carbon efficient, but we didn't take account of the health costs and the of doing that. So again, this kind of failure to take both mitigation and adaptation in an integrated framework will always cause problems, and just we have to do it in an integrated way.
Yes, the person who made the question also clarified that it was referring also to health policies. And
Yes.
we have another question. We have two questions more. So because we have a little bit of time, I will give you the two. There is any association indicated in the report on cold waves and morbidity and mortality rates, considering the potential risk of extreme cold events due to climate change?
Sorry, I didn't quite hear what the question was.
Cold
waves, yeah.
Yeah, it's about cold waves. Is been any
well, you know, yes, I mean, what we found in general is that when there are cold waves, there's also a loss of life, and there are health impacts, because especially with poor heating systems and this is the point I was making between the north and the south, because in the north, generally, when there are cold waves, the homes' heating systems are better. But in and so those the losses from cold waves compared to the losses from heat waves have been assessed over time. But the evidence is that at least in the coming decades, the losses from cold waves will be much smaller than the losses from heat waves. That's part of that is actually included in the report. I didn't mention it, but the effects over the coming decades will be much more towards having to focus on heat waves than possible effects of one of the issues is, this is also part of the just transition, that if we're raising the price of energy, and now particularly we are concerned this year with the Ukraine war, that the price of energy will be so high that there will be people will not be able to keep warm. Calefacción will be a problem in winter. But this is an exceptional situation, and of course we need to address it by providing support for cold weather. But in the medium to long term, the expectation is that the cold waves and assuming the energy transition is just, should be able to be dealt with much more easily. The problem will be much more with heat waves.
And we have a final question for you, recognizing the excellent presentation also. Could you explain how science is taking into consideration health in mitigation and adaptation? Is it regarding the impacts of different alternatives? For example, how increasing green spaces may or may not affect health, in which ways?
Yeah, I mean, what we are looking at is, and I think this is kind of encouraging, that we are being kind of creative. We are looking at new ways to address a number of problems. Projects are being proposed and ideas are being developed, which say that as we move forward, we understand that our health is affected not only by, the usual things like, of course, that we've always understood to poor lifestyles or poor diet, but they're also affected by our environment. And if as climate change takes place, we need to find solutions where the benefits of an improved environment, greener spaces, and blue spaces, spaces involving water, are better understood, and our greater access to these will have to be part of our solution to addressing the health issues in in a way which is both effective and consistent with our long-term climate goals.
Thank you, Anil. I think we already concluded the questions in the chat on time.
Thank you.
So thank you for your excellent presentation, and thank you to the audience for also the excellent questions that were given.
Thank you very much, and look forward to meeting you again soon.
Me too. I think we all will appreciate meeting you. So
Okay.
these occasions where you can teach us so many things.
Wow. Share them with you. There are other people also who work on this.
So I think we close the seminar here.
Yeah.
Thank you everyone for attending.
Thank you.